Hello and good day. This is Jim Shaw again. So protocols, standing orders, indirect supervision, offline medical control. These are some terms that can cause us a little bit of grief because they're used interchangeably throughout our medical career, and not just our medical career, more importantly, our education, because that's where a lot of you are right now. I think that there's some concern of what's going to be on the quiz. So when it comes down to terminology for this course, if it's been mentioned in the book, typically that's what we'll be using for quizzes and assignments. So we're going to transition over to our local agencies or our local county protocols just to show that we also can't make up our minds, just like in the textbooks, how we're going to use the terminology. I want to reiterate though, when it comes down to the exams for this class, use your textbook definitions, okay? Looking at the Josephine County EMS webpage, it is jocoems.com, jocoems.com, and you see that we are looking at medical protocols, okay? And so before I go any farther, I wanted to highlight that there's a calendar of events on the Josephine County webpage that you might want to come back and reference on occasion, meetings, continuing education opportunities, that kind of thing. All right, now moving on over to Jackson County Emergency Medical Services webpage. This is for Jackson County, Oregon. There are other Jackson counties throughout the nation, so make sure when you get to the webpage that you see this nice yellow Oregon sign right here. It is jcems.net, and that would be the Jackson County EMS.net webpage. On this page, you're going to notice that we are looking at standing orders. Josephine County had medical protocols. Jackson County, standing orders. So just like in the reading and what we outlined in the previous discussion, was that the terminology can be different throughout the country, even as close as these two counties are. We have the standing orders for ground and aero medical. Jackson County has special standing orders for the helicopter and airplane. Just below that, you have ground updates and air medical updates. Each year, the standing orders will be updated. You have a chance to review those. You have a chance to make recommendations. But this way you can go through the updates before they're put into effect, just to make sure that there's no errors, but you also have a better idea about where the medical practice that you're doing is going. We have the calendar of events up here at the top, and that is case reviews, continuing education, committee meetings, and those kinds of things. Document library, there's some documents here that Paul Rosticus has referenced. And then we have news and EMS agencies. Here we have listed the county, the local fire departments, and their contacts numbers. Again, this is for Jackson County, so there would be Jackson County agencies. Okay, I'll jump back over here to home. And the final thing I was going to mention on here was the Jackson County EMS email list server. This is a phenomenal way to be updated with information or to be notified of information. Of changes that are coming up or continuing education. You just enter your email, and then when something comes up, you'll receive an email regarding that. You won't receive a lot of emails through this. Monthly, you'll get one email that says, that asks, are you sure you still want to be part of this? But otherwise, just as events come up, then you'll occasionally get emails. That was an overview of the EMS web pages for our two counties locally that gives you an insight, some valuable information. So if you haven't bookmarked them, I'd try to save those locations. But if you're wanting to find the standing orders, that's where you can find the most up-to-date standing orders or protocols, whichever county you're in, however they're going to label them. So again, it comes down to terminology. The video started out to talk about terminology. At this point, I'm going to segment into what the standing orders and the protocols look for between the two counties, just as an overview. If you aren't interested, you could stop the video now, but we're going to go ahead and continue into this final segment, which is the standing orders. So Jackson County standing orders, both of these standing orders I've downloaded to my computer. I've also downloaded to my phone. I have the Adobe Reader on the iPad. I have an Adobe Reader on my cell phone as well as the laptop. And they respond very similarly between any of the systems. There are bookmarks in the standing orders. There are quick access links that work really well. So if you're on scene and you needed to look up some information, then you have that information available to you quickly. What you're seeing right here is the title sheet, and typically you'll see dates when these go into effect. On this title sheet, we actually have some links, quick links that go to the different segments of the standing orders. There's administrative rules, which are the rules that basically the overall view of what we can do without necessarily calling in right away. It gives us some guidance. There's also a bookmark link over here to the side that you can quickly move around inside the standing orders or the protocols. So both of them have a similar feature in that way. Okay. So let's see, we talked about the bookmarks, we talked about the title sheet. We'll use more of the bookmarks here in a moment. As I mentioned, the administrative rules, if I wanted to look at the equipment and lists, this is a list of minimum directly from the state of Oregon. Actually, this just talks about it, and there's actually a list a little bit farther down. Let's see, we have time on scene. So this is guidance for time on scene. Now, again, this is the standing orders. This is what we work under without having somebody stand over the top of us. This is our local supervising physician has given us this information to be able to work without asking questions all the time. Your base knowledge comes from your education. Then you go to your agency, they augment your knowledge for the field to make sure, because most education in EMS is national registry, which is the whole country, and there's a lot of variance between each of the areas, just like the terminology we were talking about. Okay, so I'm going to look at a protocol. Let's glance down here at cardiac type chest pain. Cardiac type chest pain, this is the protocol for that specifically, and the subjective information is something that the patient might tell you, or you might find out about the patient by asking questions. The objective is information that you find, that you see or hear. Assessment, again, is more information that you might see or hear. Also, there's some valuable information for educational purposes to remind you that it could be esophageal reflux instead of cardiac type chest pain. Then it gets into what the treatments are. And the treatments are listed as basic as possible, so that if there are changes made, such as the morphine dose or fentanyl dose, nitroglycerin dose, that multiple pages don't have to be updated. And so it'll be generic. If I want to know how much nitroglycerin, then I would go over to the medication protocol and look at it. Let's look over at the medication protocol for morphine. That's a favorite. Okay, it's an optional drug. It talks about the drug, how it works, those kinds of things. Some warnings, some side effects. And then finally, who it is that's allowed to use it and at what doses. This is an offline direction. So as long as I have been educated on it and have a license as an EMTI or a paramedic, then I can utilize this drug without calling the hospital or calling any form of medical direction. Now, just because we have offline medical procedures doesn't mean we don't have to call in, such as the case of activated charcoal. Activated charcoal does have a note that you actually have to use online medical. It's not bolded, which I thought it was. Anyways, so that's another one of those education things that we would do in class. You would learn that you would use it with online medical, on or offline medical. In this case, standing orders say I can use it, but I still have to get approval of online medical. Hopefully that's not too confusing. Similarly, we have the Josephine County protocols. We'll just go ahead and look at the bookmark. They have their list of treatments. For anaphylaxis, we have a subjective. Patient tells us, or the information that the patient or bystanders gives us, objective, things that we see. Then we go into the treatments. Specific doses, again, are not given. Just, again, less pages you have to edit when you go back and make changes. All right, let's look over at activated charcoal, just something to be similar. So what we see, as we did on the Jackson County protocols, was for activated charcoals, there's how the drug works, the pharmacology, when we should use it, precautions. In this case, you'll see that it's highlighted and bolded, or italicized, I should say, and bolded. Some warnings. And then we get down to the point where we have the provider levels and their dosages, their routes. In this case, we have paramedic. They have a difference in the route, and so they have it listed in two fashions here. Okay, so that was an overview of the protocols, the standing orders between the two counties. If you have any questions, please let me know, and I hope that you have a wonderful day.